Head injury is any trauma that is resulting in the injury to the scalp, skull, or brain. Initially, it may appear as only the minor injury, but however, the major internal injuries may have occurred. So, the patient with the head trauma or injury should be monitored for a number of days after the incident. The main 5 type of head injuries may occur: lacerations, concussion, contusions, hemorrhage, compression, and skull fracture. These injuries are mainly seen. Then the clinical features is mainly seen during the brain injuries. In brain injury or head trauma is intracranial hematoma, cerebral edema, ischemia, or infection, or metabolic or endocrine disturbances are seen. Other features like memory loss or brain swelling are also seen in head trauma. Then, for approaching the management of head trauma, first of all, the detailed history is asked by the relative of the patient. In history, so first of all, ask for the type of accident, whether it is RTA or fall from height, so that we can rule out the acceleration or deceleration injury, or like during the car accident or etc. Then the level of consciousness, whether the patient is unconscious or semi-conscious. If unconscious, then the duration of unconsciousness is asked. Then ask for any vomiting, if the blood in vomitus or not, or persistent vomiting is there, or the projectile vomiting was there. It is asked by the patient's relative. Then ask for any kind of seizure or epileptic fits are seen or not, because it can give the localization of the site of the trauma. Then the ask for any swelling or pain in head, or any other complaints like bleeding or watery discharge from the ear, nose, or mouth. Then the past history, like any similar head injury in the past happened or not, if any hypertension or diabetes mellitus is there in the patient. Then the personal history of the patient is asked for, like whether the patient was intoxicated or not, and then the immediate management is started. In the management, initial assessment is done of airway, then the airway, breathing, or circulation. All these are stabilized. Then it may include the maintenance of the airway along with the cervical spine control, because if any injury to the spine, then may lead to the blockage of airway, so the cervical spine is immobilized in a neutral position. Then the suction of airway is done to clear the blood or vomitus if present may block the airway. Then the chin lift or jaw thrust position is there, and oropharyngeal airway is looked for any, if there is any obstruction or not. Then if required, then tracheostomy is done. Then the maintenance of breathing is done, and the assessment of circulation or the control of hemorrhage is done by establishment of the IV access or IV infusion of with the normal saline, so to avoid the hypovolemia. Then assessment of the dysfunction of CNS is done. Then exposure in a controlled environment. Remove all the clothes and look for the obvious external injuries if present or not. Then the examination done of the patient is the pulse and blood pressure. The pulse will be rapid, thready with low BP in case of cerebral concussion. Pulse may be slow or bounding with high BP, or rapid pulse in deeply unconscious patient can be seen. Temperature in cerebral concussion or contusion injuries, it may remain subnormal, but with the appearance of cerebral compression, the temperature may rise. Now the physical examination. Head of the patient must be shaved fully to look for any injury or any like fracture or of the skull or hematoma or and the type of fracture present can be seen properly. Site of injury can be seen. Then the Eyes are also see for the condition of the pupil, or if any bleeding is present or not in the eye, hemorrhage is there or not. Then a neurological assessment is done by the Glasgow Coma scale. That is, if it is the score is 15, then there is no, with no loss of consciousness, then there is minor head injury. If it is 14 or 15 with the loss of consciousness, then it is mild head injury. If GCS score is 9 to 13, moderate, and if it is 3 to 8, then the severe head injury is there. Then check for the power, tone, or super or deep tendon reflexes also for checking the presence of the neurological deficit or not. And then the cranial nerve examination is done. Then check for any kind of CNS manifestations like ataxia and all present or not. Then the general examination is done. If any other injury like chest, for the if any chest fractures are there or not, rib fracture is there, spine fracture, pelvis fractures are present or not. Then exclude the abdomen for the rupture of any hollow viscous internal hemorrhage from injury to any solid viscous. Then the management may put a nasogastric tube to decompress the stomach and reduce the risk of vomiting or aspiration. Then avoid the nasogastric tube if there is any facial injury, as it could enter to the brain through bony fracture. Then the urinary catheter is put to check or monitor the urine output. Then avoid the insertion if any urethral injury is present. Then the treatment is of raised intracranial pressure is done by giving the IV mannitol furosemide through IV is seen. And if any like significant agitation or hypoxia is present, then hypoxia, hypovolemia, or pain is present, then give IV midazolam. Analgesics are given for the pain management as required, and the monitoring of the vitals like blood pressure, heart rate, respiratory rate, SpO2 is done, and ECG is taken. Then once the definitive injury is identified, whether what kind of injury is present in head trauma, then the definitive treatment is done then.